There are fresh calls for more regular screening checks for bowel cancer, thanks to new research into type 2 diabetes. A study's found that people with type 2 diabetes face an increased risk in all types of cancer, but it also found that men with the condition are particularly susceptible to bowel cancer. Medical reporter Sophie Scott has the story.
Peter Murphy was diagnosed with type 2 diabetes, but there was more bad news to come. A couple of years later, he was told he also had bowel cancer.
If I had have known about the link between diabetes and bowel cancer, I most certainly would have wanted to have been tested.
Now, a new study by researchers at the University of Western Australia is raising some alarm bells. They looked at 1,300 people with type 2 diabetes and what cancers they developed. They found patients with type 2 diabetes were at an increased risk of all cancers, but in particular, men had double the risk of getting bowel tumours.
There were particular concerns. One of them was that colorectal cancer, bowel cancer, was approaching twice elevated in the diabetic patients that we followed compared to people in the general population.
Doctors admit they're not sure why men with type 2 diabetes are getting more bowel tumours, but it could be that some of the risk factors for both conditions, such as obesity, are the same.
One of the theories is that the chronic exposure of cells to high blood glucose levels or high glucose levels creates abnormalities that over time cause cells to behave abnormally.
Doctors are calling for men with diabetes to be regularly checked for bowel cancer, a condition which is largely treatable if picked up early enough. Sophie Scott, ABC News.